My patient is a 35-year-old male who's been treated for adult ADHD with both antidepressant and cognitive behavioral therapies without success. He's reported long-term struggles with focus and attention, and the inability to complete simple daily tasks and constant racing thoughts that prevent him from meeting the requirements of his occupation. He's been taking Prozac for the last 8 weeks without improvement to his attention span or quality of life, and has found that the side effects incurred from this medication are more disruptive to his interpersonal relationships than he would prefer. After lengthy discussion with the doctor weighing the risks versus the benefits, she's prescribed the patient with a combination amphetamine, dextroamphetamine, or a medication more commonly known as Adderall. Adderall is a central nervous system stimulant that increases the levels of norepinephrine and dopamine in the patient's brain, as well as inhibiting the reuptake of these neurotransmitters. Norepinephrine increases arousal and alertness, and dopamine is associated with feelings of pleasure and reward and is often called the feel-good neurotransmitter. This drug should immediately work to improve the patient's day-to-day productivity and ability to focus on required tasks, thus improving his quality of life and work productivity. Additional benefits of Adderall consist of increased sense of self-confidence, increased alertness, and reduced fatigue. One attribute to this medication that may be cause for concern is that it may elicit euphoric effects and therefore has a higher rate of abuse and dependence on the medication. Additional side effects to this med consist of weight loss, appetite suppression, dysrhythmias, tachycardia, hypertension, and palpitations related to cardiac stimulation, and at times can even cause chest pains. Additionally, from the mental health aspect can cause paranoid delusions and psychosis, most commonly in individuals who have a history of mental health disorders such as schizophrenia or bipolar disorder. All right, Mr. Johnson, it looks like Dr. Smith prescribed you a new medication today in addition to lowering your dose of Prozac, right? Okay. Did she talk much to you about the side effects or what to expect when taking this medication? No? All right, let's go over a few things. This medication is called amphetamine dextroamphetamine, or you probably know it better as Adderall. This medication increases some of the chemicals in your brain, right? So it increases norepinephrine and dopamine, and it produces more of those neurotransmitters, as well as keeps them in your brain longer. So these neurotransmitters work to improve attention, focus, alertness, and your mood. Dopamine is even often referred to as the feel-good neurotransmitter. So all of that inattention that you've been struggling with, all of those feelings of having a ton of tasks to accomplish, those constant racing thoughts, all of those things that are interrupting your day-to-day activities and your ability to get your work done, those things should be largely improved immediately upon starting this medication. It looks like Dr. Smith wrote you a pretty small dose to get started with, just 10 milligrams. It is an extended release capsule. So what's going to happen is you'll take it in the morning. You'll feel the effects pretty much immediately within about the first 20 to 30 minutes after you take the medication. And because it is extended release, what happens is it kind of gives you half of the dose first thing, and then it gives you the rest of it about 4-ish hours later, and then maintains the level of benefit over the course of about 10 to 12 hours. That said, something that we want to avoid is the medication interrupting your sleep. So really important that you take the medication first thing in the morning, so that it has that 12 hours to kind of work itself out of your system, so that when you get to bed at night, it's not keeping you awake, it's not causing insomnia. We want to make sure that you're getting a restful night's sleep. Let's see, what else? With that, she did start you on a lower dose. So what's going to happen is I've rescheduled you for a phone visit in about 4 weeks. Dr. Smith is going to call you and she's going to just chat with you about how you're feeling, how you're doing on the medication, and if you're having any side effects. Speaking of side effects, let's talk about those. So some of the things that this medication can cause. It can cause an increase in your blood pressure. It can cause an increase in your heart rate. It can even cause feelings of palpitations in your chest and even chest pain in some cases. So a couple of things that we want to monitor over the next couple of weeks while you start this medication is your blood pressure. We checked your blood pressure today to get kind of a baseline. What I'm going to ask for you to do, what your homework is. About once or twice a week, check your blood pressure. Write it down in a logbook, keep track of it, and then when Dr. Smith calls you back in 4 weeks, you can report out those numbers to her, and she can just make sure that your blood pressure is maintaining and that it's staying within a healthy limit, okay? So how can you do that, right? You can walk into any pharmacy. They usually have those self-monitoring blood pressure machines. You just walk up and put your arm in it. If it's too inconvenient for you to stop at a pharmacy once or twice a week, you can walk into any Walmart or Target, Fred Meyer even. You probably even order one on Amazon. They have like electronic blood pressure cuffs. You can just check your blood pressure right at home. Tells you your heart rate on there also. Let's see, something else. It can also suppress your appetite. So with that said, we don't want you to be losing too much weight. So please also monitor your weight and be reporting that to Miss Smith when she calls you as well. In addition to that, we want to make sure that you're getting meals in, right? It's just something to be very cognizant of while you're taking this medication. Taking the medication first thing in the morning, it may suppress your appetite for several hours. You may end up missing meals. So what I'm going to ask from you is that first thing in the morning when you take your medication, you either take it with your food or you take it after you've eaten your breakfast. Have a good balanced breakfast, nutrient dense, good balance of carbohydrates, proteins, and fats. Kind of get your day going. That way you're not missing meals. You're not missing out on some of that caloric intake, right? We don't want you losing weight. Let's see. Other side effects. I don't say this to scare you, but there is some instances of paranoid delusions associated with taking this medication, as well as some psychosis. Usually this only happens in individuals, patients who have a history of mental health disorders, which you do not. So I don't anticipate you having these concerns, but if you do, please be cognizant and aware of them. If you're having any of those types of concerns, please notify us immediately. We can get your medication adjusted, we can back it off, or we can even change it to something different. Additionally, with the mental health aspect of things, and I know we've talked about this before, but this medication does have a history of abuse and dependency, and we want to make sure that you don't become addicted to the medication. Now, I know that we've talked about this in the past. You don't have a family history of addiction, and nor do you have a personal history of addiction, and you had reported that you're not concerned with becoming addicted to the medication, which is great. Just something to be conscious and aware of course. Let's see, what else do we have to talk about? Honestly, I think that pretty much covers it. Do you have any questions for me? No? Okay. If you go home this evening or, over the first couple of weeks that you're taking the medication, you come up with questions or you find that you forgot to ask something or something new pops up, please don't hesitate to message us on the portal. We get back to you usually within about 24 hours. If it's on the weekend, we'll get back to you the next business day. I have a copy of your after visit summary for you. This has your baseline vital signs and your weight on it, for comparison's sake. And then I think that's pretty much it. Your medication should be ready to pick up at your pharmacy this afternoon. Thank you so much, Mr. Johnson. Have a good day.